Hi, I'm Dr. Keith Luckett, the infectious disease physician on the UC Health Transplant team. And today I'm going to talk to you about infection prevention after transplant surgery and give you some tips on how to stay healthy. So, what do you think is the most important step in preventing infection? Is it A, hand washing, B, not taking vitamins or nutritional supplements, C, watching this video, or D, sleeping for extended periods of time to get more rest? If you answered A, hand washing, then you're correct. Although choice C, watching this video, will also help you prevent infection after surgery because we're sharing important tips that will help keep you healthy. Hand washing is crucial. Always be sure to wash your hands frequently. Always remember to avoid touching your eyes, nose, and mouth after you wash your hands. Be sure to scrub with soap and water for at least 45 seconds and always carry a bottle of hand sanitizer with you when you're in public. Beside hand washing, avoiding skin-to-skin contact is another important factor in preventing infection after surgery. True or false? Hanging around someone whom I know is sick is okay after transplant surgery because I got a flu shot. If you answered false, then you're correct. Try to steer clear from people who you know are sick. This doesn't mean you have to avoid going out completely, but just try to stay away from people who are actively coughing or sneezing. If you do go out in public, you may want to consider wearing a mask during the first 3 to 6 months after your transplant. A few additional things to remember: never share personal items like eating utensils, cups, razors, or towels with others. And always wash your hands frequently when you're in public. Because, like we mentioned earlier, washing your hands is the single most important step you can take in preventing infection. For some people, pets, like a cat or a dog, can provide therapy. Pets can also make us healthier by providing physical and mental stimulation. So if you do have a pet, don't worry. You'll still be able to hang out with your furry friend after your transplant. Just remember to keep this advice in mind. Don't change cat litter boxes. Have someone else do this. If you have fish, someone else should probably help clean the tank. Birds and reptiles carry a lot of diseases and aren't recommended for patients who've had transplants. If you have a pet like a dog, chances are you'll probably spend some time outdoors. And if you're like me, you might start to notice work that needs to be done around the yard once you're out there. Always wear gloves when outdoors gardening. Flowers with thorns can harbor bacteria and fungus, and cuts can easily get contaminated. Consider wearing a mask if you plan to turn up some dirt, and always wear insect repellent during the summer. Let's test your knowledge about post-transplant nutrition. True or false? Eating raw meats like fish or oysters is okay. The answer is false. Eating raw meat is never okay post-transplant. True or false? Consuming undercooked meat is not recommended. If you guessed true, then you're correct. We do not recommend eating undercooked meats post-transplant. To check if your meat is fully cooked, consider purchasing a meat thermometer and learning the appropriate temperatures to which meats should be cooked. True or false? I should always wash all fruits and vegetables before consumption. This is a no-brainer. Always wash your fruits and vegetables before eating, because these products could contain harmful bacteria that could make you sick. True or false? I should drink water from a well or a stream. False. Never drink water that isn't purified. Tap water from your home is always the safest and healthiest option because it's filtered through your water company. Oral hygiene can also play a big role in preventing infection. Follow these important oral care tips to help you prevent infections. Continue routine dental care. Bad teeth can lead to severe infections elsewhere in the body, so brush daily and make sure to see the dentist at least twice a year. Healing from transplant surgery is exhausting. You may be full of energy one day and fatigued on others. However, after your transplant, you may feel well enough to engage in sexual intercourse again. If you do, be sure to take precautionary measures and always use protection. Condoms prevent the spread of sexually transmitted diseases, which is an important part of maintaining your health. Another way you can avoid illness is with vaccination. Continue to get your yearly flu vaccines And make sure you stay up to date on your vaccines for pneumonia and tetanus. Try to avoid live vaccines like the shingles vaccine, measles, mumps, and rubella, and the nasal flu mist vaccine. Transplant surgery does not limit your ability to enjoy life. It just means you have to be more cautious in certain situations in order to stay healthy. You can resume certain activities you participated in prior to your surgery, like traveling, but just be sure to follow these guidelines. See either a travel clinic or an infectious disease expert prior to international travel. Consult with your physician to see if additional vaccines or antibiotics are needed before you travel. Always wear protective clothing and insect repellent when you're in rural areas. If you're traveling to an underdeveloped country, only drink bottled water and avoid ice cubes because these are just frozen contaminated water. Only eat fruit that has a rind and that you've peeled yourself, and only eat vegetables that have been thoroughly cooked. Avoiding raw meat and fish is another good idea. And due to the risk of rabies, try to avoid stray animals like cats, dogs, and bats. Like any surgery, there are certain risks and complications with a transplant. But hopefully you can avoid illness with the tips we've shared in our post-transplant video series. If you start feeling sick, contact your doctor immediately. Call the transplant office if you have a fever over 101 degrees or multiple temperatures above 100 degrees. Remember, every sniffle and cough is not an emergency, but if you start to get short of breath, have prolonged fever, have severe diarrhea, or are unable to get out of bed, call the transplant office as soon as possible. If the office asks you to go to the emergency department for evaluation, be ready to go. Most coughs and diarrhea end up being viral illnesses that go away on their own, especially once you're more than 6 months post-transplant. The transplant office may just want to call in some antibiotics, or may just want to observe you if your symptoms aren't severe. But don't worry if you start to show these symptoms. Our staff is always available to help you. Preventing infection after your transplant is possible. Everything in this video will guide you to make healthy decisions that will ultimately improve your overall health and increase your chances of having a long life with your transplant. Finally, remember that washing your hands is the most important preventative step you can take when it comes to staying healthy. If you have any further questions, please feel free to contact the transplant office.